Ladies and gentlemen, let's make welcome to the MedSift Apex 2026 conference, Mr. Chidi Okoro. With a career spanning 3 decades across healthcare, retail, and manufacturing, Chidi Okoro represents the powerful intersection of clinical knowledge and strategic business acumen. As an operating partner for a private equity firm focused on healthcare and consumer sectors in Africa, he brings unparalleled insight from the front lines of healthcare innovation and investment. His executive leadership at multinational corporations like GlaxoSmithKline and Locozed Ribena Suntory, and as CEO of UAC Foods Tiger Brands South Africa joint venture, has shaped industries and transformed markets. But Chidi Okoro is more than just a corporate executive. He is an entrepreneur who founded Drugs and Medicaments Nigeria Limited. He is an educator who serves as Adjunct Faculty at Lagos Business School, shaping the next generation of business leaders, and is a board member across healthcare, pharmaceutical, and retail sectors, bringing strategic vision to organizations navigating complex industry dynamics. A pharmacy graduate with an MBA, Mr. Okoro understands healthcare from molecule to market, from the pharmacy counter to the boardroom, from clinical outcomes to financial performance. Where most marketing advice doesn't survive contact with healthcare industry, Chidi Okoro does, because he built it there. At the MedSift Apex Masterclass, he shares an ethical marketing framework designed specifically for the compliance pressures, patient sensitivities, and competitive realities of Nigerian healthcare. Ladies and gentlemen, Mr. Chidi Okoro.
Welcome everyone in our industry. There are a couple of blocks that we have, and these blocks are merely mental. We do not believe or think that our industry lends itself to classical marketing. That's the first one. We all believe that marketing is not for us; it's for people who sell other things. Number one. Number two, we have the erroneous belief that marketing is about some people tell me about social media content or content creation, social media, etc. I said marketing is a lot broader than that. So I'm going to share a couple of illustrations. Maybe that will help us start it before you share the slide. So an uncle of mine, he lives in Omaha. He had issue. He had a medical issue, and I was looking for a laboratory. And I think he traveled all the way to Lagos. He didn't realize that Nigeria, what do they call that? Sovereign Investment Authority had set up an ultra-modern medical diagnostic lab in Omaha. Okay, so he flew all the way to Lagos, where he went to do the test. The lady, the lab scientist there was walking in Omaha and said, "Oh, guy, you flew all the way for just?" He said, "Yes." He said, "But they just set up a lab that I'm going to work for from next month." He wasn't aware these things existed, and he came all the way to Lagos. That's the first one. I think I spoke about the marketing. Healthcare in Nigeria is out of pocket largely, like in many third world. It's out of pocket. People spend when they have to spend. People are not. Insurance carries about 15 million people, and we all have insurance. We know what we get out of insurance. I have insurance too from different companies. I hardly get them used. When I'm ill, I go to see my doctor. I speak to my pharmacist or something. I do that. So healthcare have to understand that we need to fight for share of pocket of our teeming consumers. We need to be ready to fight for share of pocket. And one way to fight for share of pocket is to get involved in classical marketing. I wanted to drum this in so we all understand that if we're not fighting for share of pocket, the size of Nigeria's healthcare will remain low. We will make investments. We don't get the revenue impact nor the societal impact we desire. The other thing about healthcare is that Nigeria's life expectancy at 54 years, which is about the lowest in the world. Just know that if people die at 50, they started struggling 6 to 8 years before then. So effectively, from when they turn 45, they stop being productive. So the family is losing, the community, their village, and then Nigeria is losing. No wonder our GDP per capita looks so low, and our GDP because GDP is a measure of productivity of the nation. So let's know that healthcare is critical to success and sustenance of a country. If we don't put the energy behind that, many of us can be too technical with it. So we focus on the technical piece, but the marketing piece is where you can make the biggest value creation. Because we set up businesses to create value, to unlock value. If we're not propagating that business, positioning them well, we never truly unlock value, we never truly create value. And what happens is that the opportunities that are evident there, we do not pick it. So I think that's like in a nutshell, the conversation. Okay, good. Okay, so here is me. I'm going to share this. I tried to book consultation to see my nephrologist, a nephrologist at the hospital. And what I want to point out here is what is called, we call it customer experience in other industry. We call it customer experience, but we can use the term customer or patient experience. So I had gone through my diagnostics. So I'd done my full annual checkup. Then I presented to the hospital reception. I want to see nephrologist. I want to consult with a nephrologist. I want to consult with a cardiologist. When are they here? They didn't seem to understand what I'm doing. I eventually got an appointment. So they turned me up and down. The experience was not great. They turned me up and down. The day I showed up, I expected to see 1,000 patients waiting to see the nephrologist. I walked in, at last, I think there were 2-3 of us. I was surprised. So you can see they have installed capacity. They are not using it because the experience they give patients is terrible. Out-of-pocket healthcare in Nigeria is nearly 80%, meaning that you will have to compete for our share of pocket. That hospital right there is not competing for share of pocket because the experience they give the people who walk in there is not palatable. When people come to your facility, whether diagnostics, pharmacy, hospital, physiotherapy clinic, and they do not access you, they get the wrong experience, they're not going to come back. And marketing sits at the heart of customer experience. It's not about systems. It's about thinking the patient, the customer first. A friend of mine tried to see a physiotherapist. So he was trying to book. And this physiotherapist said, you can book online. You can call me directly. He was trying to book. 4 days after, he didn't have a conversation. He said to me, why is it difficult to book a physiotherapist? Why is it so difficult to be able to book and get an appointment? Meanwhile, the guy actually has a website, he has a WhatsApp. So I said the reason it's difficult is that he's built a platform thinking that building the platform is the marketing. The marketing is about the experience that I get when I encounter your facility. That's the marketing. And remember, your facility is both your online platform and offline. That's what it is. So I tried to see the nephrologist. There were 3 of us, and I tried to engage the nephrologist. I really had a conversation. Okay? I had a conversation, and he made clear to me that they don't get enough patients coming through. So you can go to next slide. He said to me, we do not get enough patients coming through. I was surprised. I thought there would be 1,000, 2,000, 3,000 of us. There was no one there. That shows you that as they have installed capacity, they are not optimizing it because very simple, they have not built the right customer experience platform or system. Another one is someone said their friend died of prostate cancer. So they all went to the hospital before the guy died. The guy was 47 before he died 3 years ago. So he said when they went to the hospital, they were all shocked into starting to look after themselves. So they say, you know what? They belong to some club in Lekki area. They said, we will now start to do annual checkup, including our prostate. Most of them were 45 thereabout. And these guys were over 80 people, right? Over 80 of them. I think about 60 did that test. The following year, when I had gone to speak to them, because I speak to them about their business, I focus. They're into the guys that own your biggest retail, all the biggest retail. They have money, they can spend anything on healthcare. So I went the following year and I asked them, have you guys had your annual checkup? I think about 3 or so had. I said, how come? 57 dropped off again. So one of them said, we went to that hospital, we went to the lab, and I actually told them, why don't you guys put it to remind us 1st of January, so we all turn up. Nobody reminded them. And so I reached out to the lab. I know the hospital. I reached out to the doctor. He said, it's against it's against policy to market to your patient. I said, no, I'm sorry, it's not against policy to remind your patient to come for the annual checkup. I read the document. I said, I didn't see that. So the woman said, okay, you need to build for me how I can remind people. I said, but you have a team here. It's not a big deal. So here they have lost 57 people and they have lost cross-selling and upselling opportunities. Marketing is about creating value for your patients and customers. If you're not willing people through the door, happily, you're not marketing. Go ahead, please. I want to share these illustrations. Perhaps it will help us. Our industry in healthcare, we seem to fail to appreciate the import of applying time-tested classical marketing framework. And that's what my presentation is going to be about. We miss the point. We don't realize that if we're not shouting, we will not be seen. We have this blog that we should not be shouting. Hell no, there's nothing wrong. They have given you a leeway to shout. You can engage your publics. You can engage your patients that you already have in the house. Nobody stops you from doing that. You can engage people as a group to speak about healthcare. You can engage people to speak about wellness. No law stops you. We're not saying to you to go on TV to advertise it. We're not saying that. But you can also go on TV to advertise for the entire industry, that we can now handle these kind of things. I don't know if you guys know, a lot of Nigerians leave for India to do stuff that are basic that they can do here. In the process, they go to the wrong hospital in India, they fade away. It's happening every day. Go to next slide. So let me now start to show there are a couple of strengths in healthcare that actually point to classical marketing principles. Number one, compliance to chronic disease medicines at 14% in Nigeria. I did this survey 2 years ago for a major pharmacy, and then another hospital actually took it. Because the hospital was wondering, why is it that we diagnose people with chronic diseases? We never see them again. We even have people on dialysis, we never see them again. I said, let's find out what's going on. Compliance is 14%, meaning 14 out of 100 actually comply with the chronic disease medicines you give them. Another one, people prefer herbals and organics. These are trends that we see. The other one, some patients actually go to diagnostic lab before they go to hospital or pharmacy, which is interesting. Marketing thrives on understanding consumer behavior and then building that into your narrative. But in healthcare, what we do is that we actually say, oh, they shouldn't go to diagnostic, but they're doing that anyway. How can we partner with the diagnostic to make sure that they come to you, you now refer them back to me? They want to go to diagnostic. You cannot stop it. We cannot. Changing behavior takes too long. It takes too much. They want diagnostics. How can you get them to understand the implication of that and not telling them that it's bad for them, but trying to explain to them why it's good for them and the best way to engage that? Please go ahead. So these things, the trends we see actually shows that we desire marketing. And marketing enables us to create and capture customer value. But there are issues to deal with. We need to deal with regulations. We need to deal with regulations, and then our mental blocks are actually bigger than the regulations we face. We have big mental blocks in the industry, so we set up stuff thinking that people are going to come. I saw a 5-star hospital 2 years ago, one of the big hospitals in Lagos. I won't mention their name. They actually had a banner on their wall that doctor consultation now 5,000 naira. I said, I'm not sure that's good marketing. You're already seen as a premium hospital. I said to the owner, I said, you could actually give it away for free. You can do consultation for free here. You can afford to do that rather than 5,000. It doesn't earn you anything. You have a 7-story building hospital. You have we see you for higher value delivery, not for basic malaria consultation. That's it. That's where we miss it. The other thing is our capability as individuals, as healthcare professionals. We're very technically inclined and we lose the soft side. The soft side is, how do we wheel in the customers? How do we nourish them, nurture them? And then how do we trade them up and cross-trade them? What happens is that we don't like to call them customers. The thing about calling them just patients is that we care for our patients. We deliver value to customers. That's a mentality we need to think about. The other thing is to think about the practice and the business of healthcare. Every time you have a healthcare facility, there are two things at play. That's the practice, that's governed by all the laws, that's a business. And the rules of business apply. The rules of business mean that you need a certain volume of customers paying a certain amount of money to cover your cost. That applies. So the nature of healthcare business, healthcare industry, actually calls and underscores the need for classical marketing. Go ahead, please. So a few things, we struggle with a couple of things, which patient or customer groups to focus on. I have a major hospital in Abuja, so they moved into Lagos. And I met the medical director and I asked him, what's your forte? What are you known for? You have built a massive structure. What are you known for? He went on and on that they do everything. I said, okay, let's do a survey to find out what you're known for. We did a survey. I think about 46% actually said that we know them for orthopedics. That's what they are known for. But here they are thinking they're general medical practice. We know them for orthopedics. A lot of us with our large pharmacy chain, with our diagnostics, with physiotherapy, we're not known for anything. So we also need to understand the particular needs of a chosen patient or customer. We need to understand their needs. That's very important. And what places us best? Why should they choose us? And I think that's where our capability comes into play. Why should the patient choose our facility, our diagnostics, our physiotherapy, our pharmacy? It's a tough ask. The industry, go ahead, please. Just go ahead to the next slide. The industry is changing. There's a growing private sector investment. It's escalating now. If you notice, the economy is going down, but private sector investment into healthcare is growing, meaning that competition will be gruesomely intense. It will no longer be just you with your diagnostics. It will not be just you with your hospital, the pharmacy. There'll be a lot of people playing. So what we're seeing is that on every street, you have a lot of, if you build a massive hospital, we'll build a bigger one. There's so much capital flowing into the industry. I think the government is also propelling that. We had a 200 billion naira healthcare loan. I didn't launch in 2020. That money was taken in. People built stuff. PE funds are coming this way as well. So go ahead, please. So marketing is critical for us. And I'm starting to learn now on what marketing truly means. Go ahead, please. Now, what does marketing mean? I want us to understand it, and I want us to take this away. What is the meaning of marketing? I want us to get that. Marketing is not just, because when we say marketing the way we say it, that leads us to think and believe that marketing means just advertising our services. Hell no. Marketing is beyond that. Okay? Marketing is an art. It's an art. It's science of creating, communicating, and delivering value to our clients, patients, or customers. This is what Philip Kotler says. That's simple. Value creation is your product and services portfolio. What are your product and services portfolio? What do you do best? Number two, communicating value. What is your branding? What are you known for? Then delivering value, customer, patient engagement. So go ahead. That's where the experience will come through. There are a couple of principles guiding marketing, and I want us to understand this. Number one is you got to segment the market. You have to segment it. You have to target a select group of people. It doesn't mean that you don't attend to the general group. And then you need to position your offerings. And marketing has a few attributes. The first one is relevance. It must be relevant to the chosen group. So if you're speaking to a 25-year-old about prostrate, that you're the best at prostrate, they're laughing at you. If you're trying to market healthcare to a 25-year, Nigeria's median age is 20 years. At 20, people do not invest behind their health. They don't think health is important. An average Nigerian is 20, meaning that what he sees as important is not what we may see as important. We need to get their language. Another one is consistency. Your messaging has to be consistent. Then you got to be distinct. If you're not unique, you're not going to stand out. That's key for us. We haven't seen healthcare stand out in Nigeria, but I'm going to share some illustrations with us. Go ahead, please. Go ahead. Good. Now, so healthcare, the big thing about our conversation today is we must start to apply classical marketing systems like people in fast-moving consumer goods and telecoms do. We must do that. Number one, we need to build product and services portfolio. What are we known for? What are we great at? What products and services for who? But it starts with market research. Our pricing got to be clear. What pricing do we have to place behind the customer? The place, location, footprint, promotions. How do we promote it ethically? That's very important. What partnership do we build? Now go to next slide. So I have two illustrations here, two or three. Just go to next slide. I have a couple of illustrations that I want to share. So this is what our marketing framework should be about, not what we've been thinking. Number one, how much do we understand the sector and their met and unmet needs? How much do we understand that? That's the first one. Number two, what product service offerings are we known for? Number three, how are we unique at providing those services? Four, are the clients aware that we're there? How do we communicate them? And then how do we build the right client-patient experience? How do people walk into your pharmacy and they leave there knowing that they've been cared for? I run a couple of pharmacies. In some of my pharmacies, the pharmacists are professional. People walk in there, they know they've been cared for. But in many of them, it's a bit like they're just trading, they're handing over products. If you're going to be handing over product at a pharmacy, they don't need you. There's no need for you. If I come into your diagnostic lab and you don't spend time to actually explain to me, a friend of mine came in, she wanted to do some tests. She came from Cameroon. She went to one of Nigeria's largest diagnostic labs, and she was embarrassed that everything she told them, they basically just did the test. No one engaged that to say, maybe you don't need this, you need that. That is how you generate the right experience. Okay, I think she's now in Port Harcourt, and she said that everything I said, Chidi, is what they did. So does it mean I know better than the lab scientist? Everything I told them is what they did. I've gone to review my annual checkup once. I think the doctor was reading it off Google. I mean, what experience is that? After that, I never went to that hospital again. I walked away. I never went back. I was like, you should have reviewed it before I came there. Even if you wanted to Google, okay, you should have reviewed it before I got there. So that's very important. Just know that marketing is beyond social media, content creation. They're all part of marketing, but that's the execution piece. It's all about, do you even understand the sector? The needs that they have? Do you have product portfolio that you're known for? Is there something your service, your practice is known for? How are you unique at delivering that? Do you create the right experience for customers? Go ahead. Now I have two illustrations here on patient experience or customer experience. So here's what happens. It's a great tool. The biggest tool that we can have in healthcare is delivering the right patient experience. That's the biggest opportunity that we have to do marketing. It's not regulated by anyone. It is what we have to do. What is our strategy to excel at customer experience? First one is think about Amazon, and I want us to look at other industries. Amazon, they focus a lot on lower prices to attract more customers, which increases volume, attracting third-party sellers, which expands the store, improving customer experience and momentum. So you can see how Amazon crafted it. But here is a Narayana Health. That's a hospital in India, massive. What they do is they deliver a patient-centric experience by combining high-quality medical care with affordability. So what they do is Narayana thrives on volume. So where other hospitals do carry out 2 operations in a month, they carry out 5,000 operations. In that way, they can give the highest discount. In our healthcare practices, we should have a strategy for the experience that patients have when they come to us. That's very important. Okay. The other thing that they do at Narayana, if you have a query, it's resolved pretty quickly, meaning that they are ready for the patient. They typically do what's called a pre-mortem. So they get your lab, your test result, and they review it ahead of time, and they assume likely questions that you may ask that are not stated on the result. In this way, they generate the best patient engagement, the best patient experience, meaning that the patients want to come back to them. Now they have gone to establish in Cayman Island. They went after the US market. Narayana now, I think they do about nearly 1,000 cardiac surgeries a month. That's incredible. In some countries, they don't do 10 cardiac surgeries a month. But they could do this because they were clear how they engage the patient. The patient has to get the best value from us, but they also pay the least price. Go ahead, please, next slide. So let's talk about patient customer experience. Is the biggest and best marketing opportunity in healthcare for us. And it starts with first of all, how we respond to customers, to patients. That's critical. In a lot of our facilities, we don't have a strategy for that. I'm working on that in my own facility. How quickly do we respond to people who book stuff online through WhatsApp? How quickly? These are some of the things that I'm sure you guys can all read that. Patient experience is the biggest marketing opportunity we have, and I want us to take that to heart. Go to next slide, please. Yeah, one of the things I say, there's a hospital in Owerri. This is a Regions hospital. My 80-year uncle was surprised to find out this was there for him. How did I meet Regions? One of the financiers told me, we have this hospital in Owerri. It's one of the best stroke centers in Nigeria, but we don't get patients. So Regions actually was marketing to diaspora people. They are marketing to people in Lagos, but they don't even engage people in Owerri. And I said to I had met someone who was doing work for them. I said, why don't you go to Owerri Sports Club? You're going to meet probably 200 clients that you can start to serve. That's it. And I said, the other thing you can do, you have a lot of hotels in Owerri where the diaspora come to partner with the hotels so you can engage your target public. So here they are marketing to people in the US, people in Abuja, people in Lagos, but people in Owerri don't even know they exist. Okay, I have an uncle, 80. I took him there. He was like, hang on, are you saying this thing has been here? I said, it's been here for 3 years. He didn't know about that. He said, okay, I'll now be coming here. That's all. He started going there. Okay, so you have to position and reach your audience. If you have a medical facility, don't assume that they know. Reach out to them. Go next. Next, I listed a couple of facilities. Alpha, what are they known for? My friend had his kidney transplant at University of Ilorin Teaching Hospital 2022, and I understand they have one of the best surgeons on that, but no one knew that. Nigerians are still traveling to all kinds of countries. They go to Ghana to have kidney transplant. So I had met a guy who was working. I said, why don't we know about this? You can do simple PR. You can do simple public relations that you have done this. Nobody stops you from saying that. And you can reach us if you do. Nobody stops you from saying this can be done here. You can do that through partnership. Okay, you can get NGOs to handle that for you. One of the ways you market healthcare services, NGOs, they can say anything about you. Word of mouth is great. I have it next. Air Lab, what are you known for? This is a physiotherapist in Abuja. I said to them, what are you known for? Why would I choose you? What is the reason I should choose you? Marketing answers that question. Why should the patient, customers, clients care about us? That's what marketing answers. Marketing is not just about social media posts or advertising. It's about why should they care. So marketing is a lot more internal, sorting out yourself internal than even facing the external. I like us to leave here with that conversation. Go next. I have a couple of ideas here. You need to tune up your word of mouth. That's simple. If you serve a client well, ask them for their groups. So one, there's a diagnostic lab, where I had done business with, and I just took them to the guy that runs the golf course. That's all I did. I took him to the guy that runs the golf course. I said, give him free medical checkup. They did that, and you cannot imagine the number of patients the guy referred to them. I said the guy is a top influencer. Go after him, run an annual medical for him. Now, running an annual medical by him and his group have become like a thing of prestige. That's one. Free services for them does help. Community wellness event. We hold a lot of community wellness events. Sometimes we don't know why we hold that. If you have a big man wedding, burial ceremony, wedding, it's an opportunity to market healthcare. There are ways to do that. I've seen that done in the Philippines, where Philippines are like us. Burial is big deal. So I've seen on the bulletin, you see a big hospital, a big diagnostic, big pharmacy put their ad. We're here for you, so you don't go the way of your friend, which is interesting. It's not a big deal. So how do you do that? Affinity groups as well. So things like, I worked with a group in Ibadan. I said to them, they have the traders, they have group, they can afford anything, but they don't know they need annual medical. They don't know they need to manage their chronic diseases. Can you reach out to them? Reach out to the group, and then things happen. Build products. You can do product bundling, bundle it with all kinds of stuff. That can be done. Chronic disease awareness seminars, simple. We all do that, but we don't take it to the finish line. Social media, content, of course, escalation. So that's very important. Go to next slide. I think we've got 5 minutes. Go to next slide. Okay, so another one is wellness events. I mentioned many of these. Think about how you can price your products and services creatively. Like I said to a 5-star hospital, why do you have to charge people for consultation? And, he was charging I think now they charge 50,000 or so. I said, I will not charge people for consultation, sir. They're all coming here to do stuff, what over 2 million, 3 million. Why are you bothered about 50,000 consultation? So the moment I said that, and he said, okay, I said 50,000 doesn't kill you. Take that down. Then marketing communications, of course. Now go to next slide. We can do this. So the thing about marketing, before I speak about this, the thing about marketing is that it's an investment. It takes time to pay back. Don't do it for 1 year and say you have wasted a lot of money. Again, that's where we fall through. Marketing moves your customers from transactions to engagement. Healthcare should be thinking about engagement. Healthcare should be about patient engagement, customer engagement, client engagement. That's what it is. Build awareness, acquire customers, gain loyalty over time. That's what we should be focusing on. But it takes time. It's an investment. It takes time to pay back. Go ahead. So let me round up like this. The concept of market, we need to challenge the dominant logics. Dominant logics are those things that we say and believe them because we say many times. It holds us back. We also need to learn from other industries. What are the guys who sell CSDs doing? The guys who market noodle, what do you think they do? They first of all research the market, conduct market survey, and then they build products based on what the customer said. That's important. How does the patient want to engage with your pharmacy, your diagnostics, your hospital? How do they want to engage? Do they want to engage via WhatsApp? We did something for a pharmacy chain. When we built a website for online, nobody was coming there. We realized customers wanted just simple WhatsApp. We did that. They had 3,000 patients per day. That's incredible. And out of 3,000, they fulfill about 300. None of their branches will sell 20% what they sell out of our platform. Just WhatsApp, not a big deal. Understand the customer. The concept of marketing can apply to every industry. Financial, healthcare, more so healthcare. It begins with the customer, their needs. You need to develop offerings, proposition based on the customer needs. You need to communicate it, but drive customer experience and partnership. That's critical. You need to drive experience. So the customer leaves you with positive experience. Price it to your market positioning. If you're for high end, there's a way they price for high end. But just know that even rich people don't like to throw away money. One of the ways to price premium is to bundle services together. So you bundle basic service that is cheap and free, and then you can go your premium on the other ones with the right incentive system. So also taking feedback, and the loop continues. So finally, healthcare as it is out of pocket, 80% out of pocket. Marketing is needed to win sustainably in this industry. If you want to win sustainably in terms of revenue, impact, you need marketing. And marketing is not just about social media, online, like we all say. It's not just about content creation. You need to apply the time-tested marketing, classical marketing principles. If we want healthcare facility to thrive, you need to apply those principles, and it's not complicated. It's not rocket science. Please go to next slide. I think that's where I stop. If we have, I think we have 15 minutes or so to take questions. I want us to leave here understanding what does marketing truly mean and how can we apply it to our service. But remember, it takes a lot of rigor to apply that. Go ahead, please, if you have questions. Thank you very much, everyone. Thanks for listening to me. Thank you.
Thank you so much, sir. That was beautiful. That was fantastic. We really do appreciate that. All right, this is from Better Health Plus. Okay, influencers marketing is expensive as influencers charge highly. What is the alternative?
That's a good one. That's a good one. So let me tell you about it. If you notice, I said something. I said influencer marketing is not just about going to some popular guy. Influencer marketing could be about going to the chairman of the Traders Association in Ilorin. It could be about going to the chairman of a golf course. That's an influencer there. That's a big influencer there. Think about that. Or chairman of the housing estate where you operate, giving them free medical services. It could be a free annual checkup. There's no bigger influencer than that. Think about that. So I'm not talking about going to the guys that ask you to pay 10 million naira. You can do influencer marketing in a different way. It could be about someone you know is part of a group that might be useful to you. That's what we call influencer marketing. Influencer marketing is not, we have turned it to the guys that have a 200 million followership. Is different. Okay? That's right. Thank you.
Okoro, first of all, acknowledging and appreciating you for this wonderful presentation. And she has a question and says, if you are not a premium hospital offering specialized service, what ways can we market our services?
If you're not a premium hospital, what ways can you market? The first thing about marketing is, who did you set up the hospital for? What is the target group of choice for you? Just answer that. Can she answer that? If you're clear who the target group is, you can reach them. There are different ways. You can build care plans. For a hospital, it doesn't have to be insurance. Remember, if you have a mainstream hospital that are catered to the base of a pyramid, they don't like to pay for insurance. I don't know whether you get that. They do not pay for insurance. They don't like to deposit money and use it later. They don't have the cash. So one of the things you can do is what is called care plans. Care plans are what you build, middle class, that's okay. Yeah, middle class. You build a set of care plans for certain people, depending on your experience with patients that come into you, where they make a monthly deposit and they can enjoy through the month. It can be monthly. Even middle class in Nigeria are base of a pyramid. Our middle class is a bit low because they struggle from day by day. They don't have the money. So how can you do it in a way that money they don't spend, they get to use it later, or they can transfer it? Because the moment insurance, if you don't spend it, you don't get it back. So I don't know if this clarifies. You need to build product that suits your target group, but you need to spend time to understand their needs and their mannerisms, and then you build a product based on that. It cannot be just insurance. Insurance is not penetrating fast enough, and it may never take off in Nigeria. At that level, trust deficit is very high. They don't trust. So when they pay money to insurance, once they turn them back at the hospital once, they never come back. So you can build plans that people can buy directly from your hospital and give them discount. You can also do stuff. Here's what you can do, Amala, right? You can do something where if you introduce 1 or 2 patients, you get a certain discount. If you've been with me for longer than 1 year, you no longer pay for consultation. People always question this. I said that at a forum, and I said to them, how much do you make out of phone consultation? You charge 10, 15,000 at that level. You probably make very little to buy diesel. If you take that out, would that attract more people for you? Would that make them trust you more? Yes, it does. So you can build plan. I don't have your specific situation at heart, but you can build plan that fits your market. And your market is middle class. Middle class in Nigeria are not typical middle class elsewhere. They don't have a lot of money. They don't like to throw away money. They don't have time. They don't like to go to medical facilities. Can you focus them a bit more on preventive care? So all of those things have to come into play. Middle class in Nigeria love your herbals, right? They love the herbals, organics. which is not what we love a lot in our practice. We don't love that in the hospitals. Is there a way to have a combination of the two? Okay, that's important. Someone says if you do a free consultation, here's what we do in FMCG. I worked in FMCG for long though. Here's what we do in telecoms as well. I worked in telecoms as well. I learned something. Sometimes we give people free phone. We gave you free phone. We gave you a free call. Maybe every month you have 2,000 naira free, but you were the head of the mobile cooperative. Mobile cooperative will have sometimes 5,000 users. If I give you this and you attract people for me, that's it. If you belong to this group, I give you guys discount. If you're part of this group, you get consultation discount. Sometimes we don't make a lot out of consultation, but we put it in front, and that scares away the people who come to us. When the thing about patient experience is, let the patient come in, and then you can engage and unlock opportunity with the patient. Hospitals, pharmacies, diagnostics, the way we run our operation, we scare the patient away from the reception. The people we have put at the reception are actually like, I changed 2 hospitals the last 3 years because the receptionist, first of all, tells me you're not covered. Your policy doesn't cover, you have to pay for this one. I say, let me sit now. Let me settle down. Let me sit. You could have told me, to enjoy this service, okay, you need to make this kind of deposit, but not that you're not covered. We will not deliver this to you. We use that There's nothing wrong with consultation fee, but use it with sense. If I've been with you for longer than 1 year, why should I be paying consultation all the time? If I've been coming to your hospital and I have brought my family into you and I bring my friends, the biggest influencers we can have in healthcare is a patient that's happy with us. So make more patients happy, get them to market your facility for you. This is what I'm pushing for in my own facility. It is tough, it is difficult, but work towards that. That's the only way that you can sustain your practice. Okay. If you do free consult, what about the patients now go to elsewhere for the service? Yeah, I love that. Yeah, I mean, come on. If you deliver good service, they come back to you. I'm sorry about that. Better Health Plus. If you deliver, just think about the patient experience when they come into your facility. A lot of us at the point of engagement with our receptionist is a turn off for patients. Think about that. Fix that first. You might have more patients. When patients come to you, let them be happy. When you go to a supermarket, you're happy if you can find what you're looking for. If someone can help you along the aisle, why are we not doing that? Remember, sometimes we can feel superior to our patients. We need to change that. For them to have good experience, let's stop presenting ourselves as superior. We have to come to the level of the patient so we can engage them. Okay? Yeah, if you run this, how do you achieve that? I think it's happening already. We have, I think One Health was doing that. Advantage Health does that. How do you partner with pharmacists? Absolutely, you can. You have to go sign the contract and agree the terms. That can be done. And you can reach out to my own pharmacy. We can work with you on that. We have 24 outlets. Now we're going 26. We can reach out to us. We can work on that with you. That's a way to structure the contract. Remember, go for win-win situation. If you have a telehealth program, you want to partner. When you drive partnership in our industry, go for win-win. We still do partnerships that are about me win, you lose. No, you need to go for value creation for both. And sometimes I say to people, let's practice. Let's try it for 3 months, and then we can say if we're losing or gaining. Very important. But know that you need to make investment to gain on the medium to longer term. If you don't make investment, you don't gain. Thank you. Marketing is about the customer, the patient, the client. It's not about your facility. They don't care about your facility. And marketing is beyond influencer or social media. Marketing is about understanding the needs of a patient, customer, how they want to be served, building product proposition for them, serving them well, pricing it in a way that they see value. Very important. And then communicating and delivering that value in a way that the experience is great for your clients, your patients. That's where if you do that, you can win. Think about that. Are there things that hold people from engaging with your facility? Take them out of the way. If a consultation is the problem, take it out of the way. If patient is being with you longer than 12 months, you tell them, you know what, your consultation, you get 70% discount. But, sir, you will have to introduce your family, your friends. I have met a lot of healthcare facilities I go to. I tell them I have volumes of friends, but you never ever tried to use me. I say, just use me. If you, I dragged my brother and 3 of my friends to do annual medical checkup at a facility this year. I dragged them. I just told them, oh, if you go here, you get 2% discount. I got 25% discount. And I brought 4 people. And those 4, one of them said, okay, I need to take my wife. I need to take my other friend. So you can see how. So I said to the guy at the facility, do more of this. If you do more of this, you're going to have 1,000 people over years. And then you no longer every day look for money to recharge your generator. Okay, I think that's it. Thank you very much, everyone. Thanks for listening to me. Thanks for making our time. I hope this has been found useful. Thanks a lot.